I'm in.
Hi, Kirsten. How are you today?
Good. How are you?
Good. I'm Audrey. I'm going to be a student nurse today, and I'm going to go ahead and do a head-to-toe assessment on you real quick. I'm going to wash my hands before I get started. Okay. Well, first, I'm going to go ahead and start with your scalp and work my way down. So I'm going to take a look here and make sure there's no signs of any lesions or infestations going on. And I don't see any, so that's good. I'm going to have you look up towards me. I'm going to go ahead and palpate your sinuses, your frontal and maxillary, and I just need you to tell me if there's any sensitivity or pain with that, okay?
Okay.
Go ahead and feel that. Any pain or sensitivity with that? Okay.
No.
I'm going to move on to your ears here. I'm going to feel the outer lines of them. Tell me if there's sensitivity or pain with that.
No.
Okay. There doesn't appear to be any abnormalities or lesions on your ears. I'm going to take a look at this one, okay? I'm going to check the inside of your ears for any discharge or blockage. There's none in there. And there's none present in here, which is good. I'm going to go ahead and check your eyes, and what I'm going to do is check your inner eyelids, your conjunctiva, and your sclera. And what I'm going to do is going to pull it down gently and have you look up at the ceiling for me. Okay, and your conjunctiva is pink and moist. And now I'm going to pull up on your eyelids and have you look down at the ground for me. And those your conjunctiva appears pink and moist as well. So now I'm going to do some stuff with my pen light here with your eyes, and I'm going to have to see how your eyes react to this light, okay? Okay, now I'm going to have you follow my pen light. Okay, and now I'm going to have you look at my pen light, look at the wall behind me here, and back to the pen light. Okay, so as I can assess, your eyes and eyebrows are symmetrical to your face, which is good and normal. And so, also your pupils are round, they react to light properly, and they accommodate to moving to different objects, so that's good. Moving right along, I'm going to check the inside of your nose here. Make sure your septum is aligned and your mucous membrane is moist, which is good. I'm going to have you flare your nostrils for me. Okay, and both of those are symmetrical, which is good. And now I'm going to check the patency of your nostrils, and what I'm going to do is place my finger on one nostril and have you sniff, and then I'll do the same to the other side, okay? Sniff. Okay, now the other side. Alright, and there is clear sound, so that's good. I'm going to go ahead and check your mouth, so I'm going to have you open up for me. Lift your tongue up, side to side, and stick it out and say, ah.
Ah.
Okay, from looking at that, I can assess that your mucous membranes of your mouth are pink and moist, along with your gums and your tongue, and your lips appear pink and moist with no apparent lesions, and along with your palate, your top palate, there's no lesions there at all. And then I can see your tonsils are intact. So we're going to keep on going. I'm going to have you lift your head up a little bit for me, and as I can see, your trachea is midline, which is good, and there's no apparent enlargement of your thyroid gland, which is also great. So I'm going to go ahead and auscultate your carotid arteries, and I'm going to be checking for a brewery sound. So I'm going to start on your left side here, and now your right. Okay. There's no indication of any brewery sound, and if there was, that would let me know that there was either a blockage or narrowing in the arteries, and then we would have to get that situated for you. So now what I'm going to do is assess your skin on your anterior thorax, which is your chest area. And from what I can tell, your skin is consistent with the rest of your body. The temperature is good and normal, and also there's no moisture to the touch or anything like that, so that's good. And going down to your lungs. So what I'm going to do is listen to the 8 fields of that, just to see if there's any abnormal noises or anything. I'm going to start here on your right side and just take some normal breaths for me. Okay, there's no sounds of any crackling or bronchi, which is good. And what I'm going to do here is rest my hands on your chest, and then I'm going to have you breathe in and breathe out. Okay, and both of your lungs rise and fall symmetrically, which is good. And I also noticed while you're doing your breathing techniques that you didn't use any accessory muscles to breathe, which is also good. So since we're in this general area, I was just wondering if you do a monthly breast exam.
No, I do not.
Okay, well, Kirsten, I'm going to go ahead and teach you that. So the most important thing about this is if you have a family history of breast cancer, you want to do this monthly, and the best time to do that would be at the beginning of the month. And I'm going to go show you step by step where you could do this. You could either be laying down or in the shower. So just mirror kind of what I'm doing. I'm going to lift up my right arm and put it behind my head. Then I'm going to take my opposite arm, which is my left arm, and start in the axillary, which is the armpit. And I'm going to make small circular motions down and around the breast. And then you're going to circle all the way up to the nipple, which there you would squeeze to see if any discharge came out. And if any findings of tender lumps or discharge coming from your nipple, you need to immediately notify your physician. And so after this, we're going to go ahead and assess your heart, which is located between the 2nd intercostal space and the 5th. And I'm going to go ahead and see and palpate your chest real quick and make sure there's no visual thrills or anything like that, which there's not, so that's good. So I'm going to go ahead and start on the right side of your sternum here in the 2nd intercostal space where your aortic valve is. I'm going to move over to the left, which is the palmic valve along into the 3rd. Then the 3rd and the 4th, in between there is the tricuspid valve, around here. And down to the 5th is the mitral. And also down in this 5th intercostal space at the left of the mid-clavicle line, you can find your apical pulse. So I'm going to go ahead and listen to that. And you're clear of any murmurs or dysrhythmias, so that's good. Now I'm going to go ahead and check your posterior thorax, which is your back side here. And I'm going to check your skin, make sure it's consistent with the rest of your body, which is it is. And then I'm going to go ahead and check your spine for scoliosis or kyphosis. And your spine is very aligned, so that's good. And then I'm going to go ahead and auscultate the 10 field of your lungs on your back here. Just breathe normally for me. Okay. I didn't hear any sounds of crackling or bronchi, so that's very good. Now I'm going to go ahead and move on to your upper extremities here. And what I'm going to do, let's see your arms here. I'm going to check to make sure your skin's consistent with the rest of your body, which it is. I'm going to make sure there's no lesions or signs of edema, which there's not, and there's also no moisture to the touch, which is good. Then I'm going to go ahead and check your pulses in your arms, first with the brachial pulse, and then your radial. And both of those are bilaterally symmetrical, so that's good. That's what we want. And then I'm going to go ahead and check your hands here. And I'm going to check your fingernails for capillary refill, which was less than 3 seconds. And then make sure there's no abnormal clubbing or anything with the fingernails, which there's not, so that's good. Now, I'm going to go ahead and check your abdomen, so I'm going to have you lay flat for me on the bed. Okay, and what I'm going to have you do now is take a deep breath in, because I want to make sure your abdomen is smooth and there's no apparent signs of any masses or enlargements, which there's not. So go ahead and exhale for me. And now I'm going to auscultate your quadrants for some bowel sounds, and I'm checking to see if it's hyperactive, hypoactive, if it's normal or absent. So we'll take a listen here. First, we're going to start with your right lower quadrant, your right upper quadrant, over to your left upper quadrant, down to your left lower quadrant. And your bowel sounds were normal, and if they were absent, I would make sure to go over each of the quadrants for 5 minutes each to reevaluate the sounds and reassess. Now I'm going to go ahead and lightly palpate each quadrant for any masses or enlargements. And just tell me if there's any pain with that, or tenderness. Any pain or tenderness? Okay. Alright, so that's good. Everything looking good. And I'm going to go ahead and move down to your lower extremities. You could scoot up in the bed for me with some more. Okay, good job. Okay, now I'm going to look and make sure your skin is consistent with the rest of your body, which it is. I'm going to make sure there's no apparent lesions or edema, which there's not, and there's no moisture to the touch of your skin, which is good. I'm going to go ahead and check your pulse. Your pulse is in your legs. First, the posterior tibia. Okay, and now I'm going to move up to your dorsalis pedis. And both of those were bilaterally symmetrical. And now I'm going to go ahead and move down to your toenails here and check your capillary refill, which was less than 3 seconds, so that's good. Now I'm going to test the strength of your lower extremities. What I'm going to have you do is lift your leg up a little bit, please. Have you push down on my arms. Okay, good. And now raise up against my arms. Good. And now I'm going to do some range of motion on this leg, which I would also do to the left side, but we'll just do this side. First, I'm going to do some flexion and some abduction, extension, some abduction, and adduction. Okay, and then, like I said, I'd also do the right side. So you can go ahead and sit up and put your shoes on. Thank you very much.
Thank you.